Good morning. The topic for today's class is on Introduction to Fixed Partial Dentures. The nature of a fixed prosthodontic treatment can vary from the restoration of a single tooth to the rehabilitation of the entire dentition. These restorations are the best practice builders for any clinician and can instantly restore the image and confidence in the patient. These type of technique are more sensitive and we need a clinician with a good practice to carry out these procedures because this involves the preparation of the tooth as well as it is the final result is giving a fixed prosthesis. So what happens is this procedure or this process is irreversible and can cause considerable damage to the teeth if not properly executed. So let's move to the topic. So these are different types of prostheses that you give to the patient. Okay, let's talk a little on the definitions. So the fixed prosthodontics. It is a branch of prosthodontics concerned with the replacement of the teeth by artificial substitutes that are not readily removed from the mouth. This is according to GPT 8. Now, what is fixed partial denture or a fixed dental prosthesis? FPD or an FDP. So it's a dental prosthesis that is luted, screwed or mechanically attached or otherwise securely retained to the natural teeth, tooth roots or dental implant abutments that furnish the primary support of the dental prosthesis. So this is a bridge or it be an implant also. Now, they are commonly referred to as bridges which cannot be removed by the patient himself. Okay, so the supporting teeth are termed as abutment. In this picture, as you can see, these are the abutments and the area in the center is where the tooth is missing. Okay, so the supporting teeth are called as abutments and the restoration that are cemented onto the abutment and retain the FPD in place are called as the retainers. So these are the retainers. The tooth that gives support is the abutment. The crown that you give on it is a retainer. And the artificial tooth that you replace is the pontic. So the center one is the pontic. The adjacent ones are the retainers and the tooth that gives support is the abutment. And the joint between the retainer and the pontic is called as the connector. Now, what is a crown? It's an artificial replacement that restores the missing tooth structure by surrounding part or all of the remaining structure with a material such as cast metal, porcelain, or a combination of materials such as metal or porcelain. Now, laminate veneers. These are a thin bonded restoration that restores the facial surface and part of the proximal surface of the teeth, requiring aesthetic restoration. So these laminate veneers, most commonly, if you have seen the actors and actresses, they most commonly go with this for the purpose of aesthetics. Now, what are resin bonded restorations? So it's a fixed dental prosthesis that is luted to the tooth structure, primarily the enamel, which has been etched to provide mechanical retention for the resin cement. Radicular retained restoration. From the term itself, it's understood this consists of or this is a part of the root or this restoration has to get some support from the root. So it's a it consists of a post or a dowel with an attached core. So the post is prepared in the radicular space of the endodontically treated teeth, and the core, it supports to the crown. What are the indications? The indications of FPD are, it can be given in a short edentulous space as well as in a long edentulous space as well. The abutment teeth and the supporting tissues should be healthy. To harmonize the dental occlusion in temporomandibular joint disorders, and when the patient desires for a fixed prosthesis to stabilize the splint and splint the dentition after advanced periodontal therapy, the patient has the skill and motivation to maintain good oral hygiene as well as prosthetic hygiene. So when the removal processes is not indicated, as in mentally challenged patients or physically challenged patients, giving an RPD will be difficult in their day-to-day life. So you can give an FPD if the periodontium is healthy as well as if the patient maintains a good oral hygiene. Contraindications: edentulous space with no distal abutment, long edentulous spaces, bilateral edentulous space with more than 2 teeth missing on either side, which requires a cross arch stabilization, presence of periodontally weakened abutments, teeth with very short clinical crown like congenitally malformed teeth, the patient who has a poor oral hygiene. In very young patients, we do not indicate FPD because the pulp chamber will be wide. So in young patients wherein they require the preparation for a PFM full ceramic crown, you need to reduce more amount of tooth structure. By doing so, there are high chances that the pulp gets exposed. So in very young patients, we don't indicate FPDs. And in very old patients, also we don't indicate FPD because the tooth will be brittle. And in medically compromised patients, because the periodontium will not be healthy. What are the advantages of giving an FPD? First one is aesthetics. And patient feels more secure than the removable partial denture. It's capable of directing forces along the axis of the tooth. It has a superior strength compared to the RPDs, provides a proper occlusal function, maintains arch integrity, maintains occlusal relationship, protects and preserves the remaining structures. Disadvantages includes the creation of diastema is difficult because in few patients wherein their natural teeth might have had diastema, and they might ask you to replicate the same with the artificial teeth. So that will be difficult. And the cost of remaking, if it needs to be replaced, preparation may injure pulp and periodontium abutments susceptible to recurrent decay. It involves irreversible preparation of the abutment teeth. So once prepared, you cannot do anything on it. Now coming to the classification. First one is location of edentulous space. So according to that, we have posterior, anterior, and combination. So the posterior is the FPDs confined to the posterior region alone. Anterior, it's the FPD confined to the anterior region. Combination is the FPD extending both anteriorly and posteriorly. For example, if you have to replace single or multiple teeth, as in cases of canine and premolar, that is anterior and posterior. Now, Depending on the location of the abutment, you have conventional cantilever and spring cantilever. So the conventional FPDs, in this, the abutment is located adjacent to the edentulous space and the pontic is supported on both the sides. For example, imagine your first molar is missing and you take support from the premolar and the second molar. So here the premolar and the second molar are your abutments and the molar is the pontic. Cantilever FPDs, here the abutment is located adjacent to the edentulous space, but the pontic is supported on one side only. In case of a lateral incisor and central incisor. Spring cantilever, here the abutment is not located to the edentulous space and the pontic receives support from one side alone. So a posterior abutment is used to replace an anterior tooth and a bar is used to connect the abutment and the pontic. Now the bar that you give will be rigid and it's termed as a loop connector. It's most often indicated in replacing missing maxillary central incisor, which is cannot be used in the mandible as it causes tongue interference. Now, depending on the type of connector, you have fixed movable, and fixed removable. Okay. So in fixed, the connectors on both sides are connected. See, the connectors on both sides of the pontic are rigid with no movement. In fixed movable, one of the connector is non-rigid and it's called so because it allows some movement between the pontic and the abutment. For example, a pyre abutment. In fixed removable, this was developed by Andrew and it's called as Andrews Bridge. Dr. James Andrews. This picture shows the Andrews Bridge, that is fixed removable. Now classification based on the type of material used. You have all metal, ceramic, wherein you have metal with complete ceramic coverage and metal with ceramic facing. Then you have all ceramic, then you have metal with resin facing, then you have all acrylic, composite and fiber reinforced composite. So here, all metal is the full metal crown that you advise in the posteriors. Metal ceramic is the porcelain fused to metal with complete ceramic coverage or partial ceramic coverage. That is, the labial or the buccal surface will be of ceramic covering and the lingual or the palatal surface will be with metal. That is metal with ceramic facing. The other one is the inner layer will be metal and the outer layer will be ceramic. Now all ceramic is the zirconia crown, wherein you will have no metal in it. Now metal with resin facing. So the disadvantage of this is the resin phasing will wear easily and also do not possess good color stability. Now, all acrylic, composite and fiber reinforced composites, these are only used as provisional restoration, that is the temporary restoration. Now, duration of use, you have provisional or temporary FPDs, long-term temporary FPDs and definitive FPD. So in provisional or temporary FPD, they are usually made of acrylic resin. That is the temporary crown that you give immediately after the preparation of tooth. So we give that to improve the confidence in the patient as well as in the clinician. Now, long-term FPDs, this is given in situation wherein the definitive treatment plan is not finalized. And definitive FPD is the final prosthesis that you give cement in the patient's mouth. You have, according to span length, it's short span FPD and long span FPD. So in short span FPD, as from the word itself, it's understood it replaces one or two adjacent teeth and is confined to 3 to 4 units. Long span is the FPD which replaces more than two adjacent teeth. And depending on the type of retention, you have frictional resistance and micro retention. So in frictional resistance, the FPDs retain with the parallel walls of the prepared tooth. And in micro retention, the retention of the resin bonded restoration depends on the bonding ability of resin and the surface irregularities. Type of support, you have tooth supported, implant supported, and the combination of tooth and implant supported. To summarize this chapter, this is just an introduction to the topic. Okay, so the subsequent chapters will deal with the components and fabrication of FPDs. Thank you.